Now, why health insurance is important for the country like ours? Now, let us look at the current situation of health care in India. First of all, paying cash out of pocket for the health care is not sustainable and not scalable. It is like if you do not have a motor car insurance, if you all have to have cash money to settle the dispute in case you meet with an accident, or repair your car when there is an accident, nobody is going to drive the car. Because there is a motor insurance and it is mandatory, the cost is low, it is affordable, everyone has a motor car insurance. So why health insurance is important? It's because today there are three important stakeholders in delivering healthcare. The first one is the hospital. The second stakeholder, insurance company. And the third and the most important stakeholder is the patient. Now, in this three stakeholder relationship, hospitals do not trust the insurance company. Insurance company doesn't trust the hospitals. And the patient doesn't trust both parties. So in this game, we have three stakeholders who do not trust each other. If there is in this foundation of total lack of trust between the three major stakeholders, the business cannot be scaled up. It has to change. Now, why it has to change? I sit on my chair, talk to the patient, and I tell the patient that you need a bypass grafting operation. The first thing in the corner of the mind, what the patient thinks is, do I really need the bypass grafting? Do I really need it, or this doctor is asking me for the bypass because he will be benefited? Now, change the scenario. I become a health insurance company and I have offered the health insurance to millions of people. Then when I tell them that you need a bypass grafting, there is no conflict of interest because I'm going to pay for the operation. So the whole relationship changes. About 14% of the heart surgery done in India is done by our group across the country. Now, more people develop heart attack, it is better for my business. So in any business, the service provider and the client, if their interest is not aligned, as a healthcare provider today, my interest is not aligned with the customer. Because if the customer has a health problem, I am going to be benefited. I have no incentive to ensure that the customer's health is maintained. Whereas when I become a health insurance company, my relationship with the client will change. Because if the patient doesn't develop a heart attack, I will save the money if I am a health insurance company. Whereas if the patient develops a heart attack, I will lose the money. So it is my interest that my members who have subscribed to my insurance do not fall sick. So I will work very, very hard to make sure that everyone has an excellent primary care, everyone undergoes routine preventive checkup, and any small problem we have, we address it right away. So then it is good for the patient and good for my industry. And this is how healthcare can get transformed in a large country like India. So we